Hello guys, how you guys doing? You're welcome to another edition of my program called Health Talk with Queen Nikki. Health Talk with Queen Nikki. Okay? HTQ. HTQ. Okay, I just love that HTQ. Okay. Okay, so I downloaded a video about self-medication awareness, and I got a lot of reaction. My email is full. Okay, so I am bringing another supporting video because they want me to expatiate on multivitamins that I talked about in that video. So let's talk about multivitamins. Now, this video can go to part 1 and 2, but I will try and see if I can summarize everything in one. If not, please watch part 2 of this video. So I will start the multivitamin starting from pregnant women, okay? Starting from pregnant, and I'll work my way to old age, which is the elderly, okay? Let's start. Now, in that video, we talked about multivitamin. I talked about multivitamin, that we can get it. We don't need doctor prescription, right, to get multivitamin. Now, if you're pregnant, or you are, let's start from if you want to conceive. There are some multivitamins that you can take, but make sure if you are in the range of childbearing woman, you are and you are trying to conceive, please make sure when you buy over-the-counter multivitamin, it must have high in folic acid. The reason why you need folic acid high in the multivitamin is because you don't want to have child defect, especially if you are above 40, in the late 30s. You want to increase your intake of folic acid so you can prevent all this neurotube defect child and all those Down syndrome, because it's very high at that age. So you want to make sure you have high folic acid. Now, let's say when you are pregnant, you need to start taking your as per doctor prescription, okay? At this time, it's as per doctor prescription. You take your your prenatal vitamin, which will be high too in folic acid too, okay? So once you take your prenatal vitamin as per doctor prescription throughout the pregnancy, if you have your baby, you still need to continue that multivitamin because the baby still need to get it from the breastfeeding, especially if you're breastfeeding from the milk. The baby still need to get the multivitamin at least for 6 months, okay? So when you continue the multivitamin, if you're not breastfeeding or maybe you're not getting enough supply, you can ask your pediatrician, which is your child doctor, to see if he can prescribe multivitamin, or if the child don't need it, there's no point giving it, okay? There's no point, okay? This have to be strictly pediatrician recommendation, okay? So now let's proceed. For children between 1 to 3 years old, they are very picky eater. There are some children multivitamin that you can buy over the counter as long as it's not compromising their health. If they don't have any health or disease process that is preventing them from taking multivitamin, because they are very picky eater. There are some multivitamin that children need from 1 year old to 18 years old because their brain is trying to grow, okay? So there are some calorie of multivitamin that they need to take, but they're not going to eat it because they are, especially 1 to 3, they are very picky eater. So you can just give them that multivitamin and they should be good to go. In addition to the multivitamin, there are some food supplements but make it colorful. That's why I said when you're dealing with children of that age, everything is visual. Once you make the food colorful, they don't want to eat their vegetable. They don't like it. They're like, ew. But I love them. I love to work with this set of people. So what we can do as a parent, as a pediatric, we make the thing colorful. Make it colorful. If you are putting broccoli, make sure it's green. It's green pulp, and put it in their favorite plate. Okay, where maybe it has their favorite character custard. If they like Elmo, put it in that Elmo plate. If they like Disney princesses, put it in that Disney princess. It attracts them to eat it, okay? Yeah, it attracts them. And you have to play along. If you want toddler to eat the vegetables with you, you have to play along. Pretend like you're eating meat and they're enjoying it so they can, because they are like, you play along in that age that worked, okay? So you give them additional food to supplement with the vitamins, okay? Because they need it, their brain is still growing, okay? As per the pediatrician recommendation. But if you just want them to look skinny, because multivitamins do a lot in children's body. It makes their skin glow, it makes them eat very well, it makes their height grow very well, their brain function very well, okay, in addition to the nutrition that you're giving them. Okay, now let's continue. Now let's move to the next set of people, the school age. This is from 4 to like 18. Let me just round it up like that. From 4 to 18 years old, they still need one form of multivitamin, especially for those who just started their pink lady, their period. They need to replenish the monthly period that they do. And this can vary, because we've seen children start their period at 12 years old till, further like that. So they need to replenish the blood that they are losing. That's why they need to take multivitamins to replenish that with folate and all the stuff. Now, because of the blood that they are losing, they need to increase their vegetable intake that can supply, iron too. Yeah, and we have so many food classes. I can do video if you guys want video of that you can add in addition to multivitamin. We have so many multivitamin, but I don't want to mention, like I said, I don't want to mention it, but the popular one that is in store that we can use is Centrum. Centrum is very, very good. I love it. I use Centrum. So you can just buy it and give it to them. But make sure you consult their pediatrician to make sure if it's okay to give it. And sometimes the pediatrician, they usually prescribe iron medication for those kids too, in addition to that. And they would monthly or frequently check their H&H, hemoglobin and hematocrit, their blood level, to make sure they are not losing too much blood, okay? Now, let's continue. Those one is food. Consult their primary care doctor, or just buy it over the counter to give if you notice that they are, in good shape, health, okay? Now, let's move forward. So, we have childbearing age, which is the one that I discussed earlier, that want to have children. Make sure you increase folic acid. There are some multivitamins that have all the nutrients, including folic acid. Just look at the percentage. When you turn the multivitamin at the back, you will see all those nutrients that is there. As long as it's high in folic acid, sometimes you buy the multivitamin, you have to buy additional folic acid to make it good, okay? And you're good to go. But make sure with that too, you still increase your nutritional intake of all those vitamins, like your fruit and vegetable, your protein, your vitamin, your vegetable, green leaf, anything green is very, very good. Okay, then we go to adult that is above 50 years old. There are some multivitamins. Centrum to have the same too, that is like they call it silver above 50 years, right? Yeah, you can also use it, but this time around you have to be very, very careful when you're using it with elder, because too much of calcium in those vitamins can cause kidney stone, and you don't want it. So you still have to consult their doctor to make sure if it's appropriate for them to use before you start using it. And if you're using it for elderly, like your mom, your dad, make sure you increase water intake. You don't want them to have kidney stone, okay? So they have multivitamin above 50 years, okay? I hope this video helped, okay? I hope it helped, and I did it with one video. I'm so happy. Okay, if you need additional information, let me know, and make sure you stay glued to my page, because we're bringing yummy things. Till I see you guys, remain blessed, and God bless you.